Welcome, everyone. Thank you for joining us for this quarter's MS Activist webinar, Strengthening Our Advocacy and Expanding Our Impact. Today, I'll start by going through some logistics for this Zoom webinar. We will walk through the highlights of some of your good work, MS Activist good work from this year. I'll introduce our new partners from Crossroads Strategies and do an interview with them. We will talk through some policy wins, both state and federal, from 2025, give updates on key priorities for the rest of 2025, and then we'll have some next steps. Before we start, I will read through our vision, mission, and idea statement. Our vision is a world free of MS. Our mission is we will cure MS while empowering people affected by MS to live their best lives. Our commitment to inclusion, diversity, equity, and accessibility as we amplify the voices of all people affected by MS and celebrate our differences in the drive to end MS. We affirm the space for everyone to express their perspectives, fueling our vision with innovative ideas and insights. We commit to advancing inclusion, diversity, equity, and accessibility within our workforce and across the MS movement. This slide, you have some guidance on Zoom logistics. Today's session is already being recorded. It will be shared out after this meeting. You are all currently on mute. You can feel free to ask questions in the Q&A box at any time, or later you could raise your hand to come off mute during the Q&A at the end of the interview session, if that is how we want to answer your question. Use the chat to participate in the call. I see people are already doing that, and connect with other MS activists. And finally, if you would like to use closed captioning, just click the CC button at any time. And Holly already copy pasted and put this in the chat at the very top of the chat. I won't read through this. It's just a reminder that this is meant to be a safe space where everyone is respectful of one another. And finally, our speakers. So I didn't even introduce myself. I'm Stephanie Stern. I'm the Vice President of Advocacy here at the National MS Society. I've worked here for, it's almost 11 years now, and I've been active with the society off and on my whole life because my mother lives with MS. I will be joined later by our incredible AVP of State Advocacy and Policy, Laura Hoke, who will be taking over as moderator after the Q&A session. All right, so we're going to begin today by congratulating all of you for your hard work and your resilience. We asked you to engage in our advocacy work on a very consistent basis this year because we had a lot of high priority issues moving all at the same time in the states and in Congress, but you all really rose to the challenge. You responded to our calls to action as we worked together to advocate for funding medical research and healthcare access and a whole lot more. So on this slide, you can see some of our figures. We had 384 visits with federal legislators and staff, 22 state action days, over 48,000 emails to elected officials. These are the action alerts. Almost 1,800 phone calls to Congress. We recruited 66 new district activist leaders. You all did letters to the editor, op-eds, we got media mentions. It was an incredible year. And we know that with our work with Congress this year has probably felt more like a marathon and not a sprint. And we appreciated that you really remained with us, remained steadfast and relentless as you advocated for all kinds of policy solutions that help people affected by MS to live their best lives. Later in this program, we will talk about more specifics on the state and federal level progress over the year and look at how we as activists can best position ourselves to have a continued impact for the rest of 2025 and into 2026. And now I get to introduce our featured guests. Last month, we were thrilled to be able to bring on Crossroads Strategies as strategic partners in the work that we do to ensure that the voices of people with MS are heard by those in power. Crossroads Strategies, LLC is a bipartisan, multidisciplinary federal relations advocacy and advisory firm based in DC. They offer services from congressional affairs to agency and regulatory lobbying. And I'm going to introduce you to two very impressive members of their team, Brittany Hernandez and Jason Van Pelt. Both Brittany and Jason spent many years on the Hill honing their knowledge, and they have incredible relationships. And then they explored paths outside of Congress. Brittany has worked within the patient advocacy world. She led federal affairs on healthcare access and quality for March of Dimes. And then she worked as the Muscular Dystrophy Association's head of policy and advocacy. And Jason also has an incredible background, spent over a decade engaged in pharmaceutical advocacy, looking at potential impact and ensuring the timely development of appropriate policy solutions. So we're really pleased to have them as members of our team working with us to advocate for what matters most to the MS community. And I'll give a shout out for them for joining us today, given all that's happening. It's the last day of the fiscal year. So they're very busy people, especially on a day like today. And before I start asking questions, I will, first of all, I'll note we will take some questions after I do the Q&A with Brittany and Jason. So you can put your questions into that box. And I want to set up the conversation and share a little bit more about why we decided to partner with Crossroads. So we all know there's a lot at stake in the decisions made by Congress and by the administration, and their decisions have a direct impact on the lives of people living with MS. Everything from the way that your mobility devices are treated when you fly to which medications you have access to. And we know people affected by MS absolutely must have a voice on the Hill. And as much as we can, we try to make that voice yours. But we also know it's important to have eyes and ears on the Hill really year round and giving us access to timely intel to help us be strategic. And again, make sure your voices are heard and our priority issues are addressed. So right now, there's a lot going on. It's a super busy year in this Congress and within the administration, and there's so many policy developments and a lot of breaking news. And I think, we all know we've always been effective at getting our message across, but it has been harder to break through the noise on Capitol Hill, given everything that's going on, all the issues competing for attention. And we recognize the need for some additional support to help us gain some access to targeted key legislators and their staff. And we also have been talking to a lot of other nonprofit advocacy groups who are working with consultants like Crossroads to maximize their impact, and they're having a lot of success. So we had a generous gift and we were able to contract with Crossroads, far and away one of the most respected bipartisan government affairs groups in DC. So I think we all can think of them as another tool in our toolbox working for us on Capitol Hill. So I will stop talking now. I have set the stage and now I will start asking questions. Again, a lot is happening today. We are down to the wire. September 30th is the end of our fiscal year and the deadline for Congress to pass a funding bill. So Brittany and Jason, my question is, where do things stand right now? What is each side asking for or hoping the outcome will be in terms of policy gains or scoring political points?
So I think, where things then, thank you, Stephanie, for that wonderful introduction. We are really excited to work with you guys. It's definitely, a big get for me to work with this organization, given how long we partnered in the patient advocacy space. And just we're really excited to work with y'all and on behalf of, all patients and families living with MS. But where do things stand today? Unclear. So as you said, today is the end of the fiscal year. The government has to act today or Congress has to act today to fund the federal government moving forward. And it certainly seems like we are headed into a shutdown tonight. The reality is that yesterday there was a meeting at the White House with leader Chuck Schumer and leader Hakeem Jeffries, the two Democratic Party leaders in Congress, with the White House, and they came out with nothing. The meeting itself seemed like it was relatively to be expected. There weren't a lot of surprises out of it, but I would say that when Jeffries and Schumer walked out of there, they, addressed the press and said that we made no progress, and they are continuing to, stick to their principles, which are, in order to come to the table to vote to fund the federal government, they're requiring that the Republicans work with them on extending tax credits to make healthcare plans on the ACA marketplaces more affordable, and that discussion has not happened. Now, I will say it did seem, or the reports were that the president seemed more inclined to have these discussions maybe than some of the Republican congressional leaders, but he only seemed inclined to have those discussions while the government was open. So we kind of remain in a standstill, and I do think that a shutdown will probably happen tonight.
So I do just add on to what Brittany said. I think we're anticipating two votes around 5 o'clock in the Senate. It would be trying to advance either the Republican or the Democratic proposal for temporary funding. As Brittany outlined, I mean, the Republican proposal, it's very weird for those that follow politics up here. Over the last 20 years, 25 years, it's typically been Republicans that have tried to shut down the government over policy disputes, where they have tried to advocate for adding additional policies. At the end of the fiscal year, it is a time where a party, particularly if you're in the minority, you have the most leverage, because typically, I think over the last 25 years, we've only had one Congress where one party or the other had a 60-vote majority in the Senate, which is the minimum you need if you can't get members from the other party to support you on moving most significant pieces of legislation. And that's the case now. Although Republicans are in the majority in the Senate, it is a very narrow majority, and they need Democratic support to move big pieces of legislation. And so from Schumer's perspective, obviously this is his maximum point of leverage to get things they want. I think Republicans with a few exceptions, feel largely comfortable with. They've offered a clean 7-week extension, so continuing government funding for another 7 weeks, I think, to November 20th, and that they would talk about the expanded tax credits over those 7 weeks. Republican concerns there being, not in no particular order, no Republicans ever voted for them. The expanded credits were authorized under Democratic control with only Democratic votes. There are concerns about the budgetary impact. They're about $340 billion over 10 years. There are concerns that they're overly generous. Lots of apocryphal stories of people making hundreds of thousands of dollars a year and still getting taxpayer credits for their insurance. And then there are some policy folks that are like, we need to tackle affordability, and that this just kind of papers over the affordability problem by offering taxpayer funds to subsidize it. So I expect both votes at 5 o'clock will fail and will shut down. Unclear what brings us out of the shutdown. There doesn't seem to be an immediate trigger this week, or I think even next week. And I apologize, Stephanie, if I'm getting ahead of you a little bit, but I think there's always the prospect. We're in hurricane season, so I like to say if a hurricane were to hit Florida, for example, big state, lots of Republicans, lots of Democrats, that might force Congress to act. There are other external events that could push them, but as of right now, it doesn't appear that either party has really laid out what would allow them to move forward.
Thank you. And you did address one of the key issues that we are following in this negotiation. It is, the National MS Society has always paid attention to the spending bills because we care so deeply about funding for MS research through the National Institutes of Health and the MS Research Program through the Department of War. But this time we have been advocating for over a year for these enhanced tax credits. So we're paying particularly close attention to how those negotiations play out. We have absolutely no position as a National MS Society on a shutdown or the process or anything, but because that has become a sticking point where we're paying such close attention. But I'll ask, I guess, the next question. I'm very curious. You're both DC insiders. I think of you as ultimate DC insiders, and you're Hill veterans. We're interested in your candid perspective. How do you characterize, again, this is maybe it's an interesting snapshot because it's a shutdown day. How do you characterize what is it like to work in Washington and do government affairs right now? What's it like to work with the 119th Congress?
I mean, I think things are more polarized than they have ever been, right? I was on the Hill when the Tea Party came to town, way back in, what was that, 2010,
Mhm.
halfway through the first Obama administration, and we thought things were polarized then. And I do think that it is vastly different now. The reality, though, is that folks like members of Congress on both sides of the aisle, for the most part, will find partners to work with when it comes to moving forward shared priorities. And it's not something generally that, they pursue in order to, grab headlines or something like that. But, there are still many, many members of Congress who know that bipartisanship is generally the only path forward, that control flip-flops every 2 to 4 years in Congress. And, that the reality is that without a Republican and a Democrat engaged on something, you will likely not move forward policies that impact everyday Americans, new policies that impact everyday Americans. I think that just because things are really polarized right now, that doesn't mean that there aren't opportunities. They are more difficult to find, though. And so you have to find members that you can work with around the edges to, who have been identified as possibly, being interested in, for example, NIH research funding. That we have seen a lot of members who've come out in response to the administration's original cuts at the beginning of this year. A lot of Republican members who came out and said, wait, no, wait a second, like we're not supportive of this. And while, they didn't need Democrats to help them with that, they certainly were having discussions across the aisle about, what was most needed when it came to saving some research at the NIH.
As one of our former interns put it, I started working on the Hill in the late 1900s. And I thought at that time things were super polarized and it was nothing compared to the way things are now. Um, I will add to what Brittany said, it's a little touchy for us. We still are engaged with civil servants, in the executive branch. We're still engaged with congressional staff, and all those people in, what is it, 11 hours are going to be expected most of them will be expected to come to work and basically work without getting paid. So that is a touchy time, like going forward over the next couple weeks, where we have to balance sort of the needs of the advocacy we need to do with being respectful of the fact that these folks are being asked to show up and work for free. So keep that in mind if you're traveling soon. When you're at the airport, both TSA and your air traffic controllers will be working for no pay at the time, although they will get back pay.
That is, yes, that is well, I guess be nice to TSA in general, but especially right now. So this is a follow-up question. From your perspective, what strategies or what tactics are still useful for advocacy organizations such as the Society in terms of advancing our agenda, and what strategies or tactics are no longer working the way that they did in the past?
No, I still think engaging with people that have this personal connection to an issue is huge. I was a Health LA for 5 years for a member of one of the health subcommittees. I still remember the stories I was told by different advocates. I personally, I have friends that were touched by MS. My father had Parkinson's for 20 years. But bringing up those personal stories and the personal impacts that the disease has on you and your life, I think is still very effective. These staffers, it is not like Hollywood. Most of them are meeting with, every, 20 minutes, every 30 minutes. they're meeting with a different group. It can be totally different issue sets having nothing to do with healthcare, let alone something that's healthcare and disease specific. And so making your time in front of them or with them memorable, and I think personalization goes a long way to driving that home. So that later on when they're, talking to their bosses, if you just met with staff, or if they're talking with committee staff, because oftentimes it's the staff that are really making those decisions and actively pushing legislation forward, less so than the elected member of Congress. That really sticks in their heads.
Yeah, I agree with Jason. And I also think that, um, the capability of of the National MS Society to organize other patient advocacy organizations is something that is really impressive. So, back when I was at March of Dimes and MDA, we started this was in 2017 during President Trump's first term. We started an advocacy coalition around preserving the Affordable Care Act from the repeal process. The MS Society was obviously a huge part of that. I think the reality is that the messaging from patient advocacy organizations, directly from patients themselves, from family members, other consumers, is incredibly effective. And we know that when we're organized with a unified message across that larger community, that we were able to multiply our message 10 100 fold. And so my advice would be to continue with the society's longstanding successful history in organizing the other patient advocacy groups, because we know that it makes an impact, and we know that congressional offices pay attention when they hear from constituents in their districts, obviously, but also from the leadership of these organizations when they are unified.
Thank you so much. I do find it very reassuring, encouraging to hear that our most powerful tool, which is everybody that's joining us today, our network of advocates, that is still a powerful tool, no matter what the environment is. The constituents' voices matter. All of our voices matter. What advice do you have for our advocates? They all want to be as effective as possible when they're communicating with or meeting with their members of Congress. And even more specifically, one of the tasks we're focusing on right now for shoring up research for the MS research program, for example, is how do we work to identify the champions that we need and make sure that they remain our strong partners?
I mean, I think, my first reaction to this is that your story is the most powerful one. So when I was like Jason, when I was a congressional staffer, I, met with thousands of people, in my time there. And I still remember the parents or the children of people who lived with conditions like and including MS, and honing your story and being willing to share that with folks is really impactful. I know it's not easy. Like, it is challenging for patients to, and for people to talk about this thing that has taken over their life. Like, I understand that. I think a lot of congressional staff, though, don't necessarily understand that. They don't live it every day. They might not have a friend or a family member who live with a condition as challenging as MS. Just for people's background information, most congressional staff are like, they start in their early 20s, they last for maybe 5 years, and then they leave. And so, like, when you're meeting with a personal office staffer, now not a committee staff, but like a personal office staffer, generally you're meeting with somebody who has become an issue expert by virtue of the fact that their boss said, okay, now you're going to handle the healthcare portfolio. And that is a challenge, right? Like, these are not people who necessarily have master's degrees in public health or anything like that. Like, these are folks who started answering the phones and got promoted. And so, like, the best way to make an impact with them is to connect with them personally. I think though, Stephanie, to your question about finding champions, the way to make a champion into, out of a member of Congress is to create that personal connection, and find folks within their constituencies or within their social networks that agree with you. And so a lot of the work that we do at Crossroads is helping advocacy organizations identify good and unique opportunities to utilize grass tops advocates. And grass tops advocates are folks who like might be friends with a member of Congress or go to church with them or work with them in some kind of like business setting, something like that. Like those are really effective things for us to utilize, but we don't know about them if we don't have the relationships with people on the ground who live in the districts and know them, people like you guys. So I would say, my advice would be you don't need to be in DC all the time. You don't need to have every answer to every question about every policy proposal. But like if you see your member of Congress at the grocery store or, at school drop off or something like that, like tell us. That would be really great. Or if somebody knows them, that's also great because creating those personal connections sometimes is really what it takes to get something over the finish line with getting a member added on, to either like co-sponsoring a bill or signing a letter or something like that. And those are really actual, meaningful things for us to do because these people do represent you. And so they are in your communities. And there's 435 in the House and 100 in the Senate, and they are supposed to be accessible. And so if you find them, access them and tell us about it.
Yeah, I agree with all that. I would just add, as a constituent, you should be able to meet with your member, but if you can't and you are talking to a staff member, that is still a fantastic opportunity. I've for years now told clients, don't waste the chance. If you are talking to this 23-year-old, you might think it's very odd, but that could be the person in the office that actually follows healthcare closely and will be the person that constantly is reminding their boss, hey, remember, I talked to your constituent, and this is an important issue for some of the people you represent. And sometimes that's all you really need to get a member, to join a caucus, to co-sponsor a bill, certainly to vote a certain way. People really are surprised at how much our legislative branch is at the mercy of 20 and 30-year-olds. But they're the ones that are dealing with these issues day in and day out, and their bosses have to cover even more than any individual staffer. So and Brittany is right. The average, I think it's 2 to 5 years. But if you can establish a connection with a congressional staffer, that can go a really long way at advancing the cause.
Absolutely. And I do love hearing you say, Jason, that you remember some of the stories that people told you all these years later, which I think is so, I hear that all the time. My last question before we take some questions that our audience has submitted is my favorite question. What is your crystal ball prediction for what the rest of this calendar year will look like?
I'll take it first, but I'm going to caveat this with I'm the Democrat on the call, so I'll let Jason clean up after me. So my crystal ball prediction is that we go into a shutdown today, that it lasts for probably no more than 2 weeks, that we come back and reopen the government with some kind of negotiation around an extension of funding for the affordability tax credits for our ACA marketplace plans. How long is that funding for? I don't know. Maybe 2 years, but it's going to be I don't think Democrats are currently requesting a permanent extension, which is a 10-year extension. I don't think the reality is that can be served. Though for the remainder of the year, it really depends on how long the CR is that they come back with, right? Like if they come back with a CR that only funds us through November 20th, which is what's currently on the table, I think we do this whole thing again on November 20th, or, shortly thereafter, in early December. We've had shutdown fights at the end of the year before, we've had threats of canceling Christmas by, congressional leadership before. And I think that the reality is that we'll probably be looking at that. I don't really foresee any big healthcare policy packages or consumer protection policy packages passing anytime or being considered anytime between now and the end of the year. There's a lot of things that need to be handled, like the expiring provisions that fund the community health centers, that fund telehealth, support services for people for the opioid epidemic. Like all of that has to be done because they're all expiring today. But I don't think that the reality is that we will see any larger healthcare package go along with that.
So to add on to what Brittany said, if you look back over the year, there's actually been a fair amount of legislation. I mean, One Big Beautiful Bill had a lot in it. And so from a Republican perspective, they have already done a lot of the legislating they would like to do for the year. They obviously still need to fund the government for the remainder of the fiscal year. Or I should starting with the new fiscal year starting tomorrow. They need to probably pass the defense authorization bill. They've done that every year for like 62 years running. And then there is a package of healthcare provisions, both that are expiring today and then others that expire at the end of the calendar year. Those things, though, a lot of that already has fairly strong bipartisan support. There's not, I don't think, a lot of question over what that would include. And I say that only because they really need to solve the spending puzzle first. And those healthcare provisions that Brittany mentioned would likely ride along with whatever legislation reopens the government if we do in fact shut down. Congress is famous for working best when there is a deadline, which is why the Republican proposal was till November 20th. If you look at a calendar, that's right before the week of Thanksgiving, which is typically a recess week for Congress. And if that is the outcome of the current crisis, then yes, we will probably be in November having this very similar conversation. They might bump it out to right before Christmas. The only other thing Congress likes to do as much as set a deadline is extend a deadline. So I certainly have been working between Christmas and New Year's. I know there are times when they've been rushing paperwork from one side of the Capitol to the other to keep the government open at the end of the year, to extend tax provisions that were expiring at the end of the year. So a lot of needless drama, but I do think from a Republican perspective, it's a pretty short, I mean, they're important things, but it's a pretty short list of legislative items that they want to achieve. I wouldn't expect any other major pieces of healthcare legislation to make it through this year. And it's a challenge because next year, given that it's an election year for every member of the House and a third of the US Senate, it generally is an abbreviated legislative period. So like the first half of the year could see a lot of activity. So this will partly set it up. And one of the arguments they're going to have to take care of the items I mentioned now is that they don't want to have to start in January when they have a limited amount of time ahead of them with taking care of items that should have been acted on in 2025.
Well, thank you both. The crystal ball seems murky at best, but I did hear that we're going to have a lot of what I would call opportunities to keep engaging with Congress, with the administration, keep advocating. So there, lots of good times working together ahead. And I see Holly coming up. I think she's going to ask us, before you go, a couple of questions from our attendees today.
Yeah, thanks so much for joining us. We have several questions. A lot of them are asking specifically about the MS research program and if there's any chance that that could possibly be included in funding this year, but also some questions about what looking ahead might be our future strategy on restoring the funding.
So we have in the time that we've started working with the society, Jason, myself, and our colleagues have done a lot of engagement and outreach, primarily with congressional leadership on funding for the MS research program. As I'm sure everyone here knows, there were a number of research priorities within that program that were eliminated this year and are no longer funded for this year. My general inclination is that I don't think that we will get those re-added for FY26. I do think that there is a real possibility for effective advocacy to have this program reinstated for FY27. Members have told us that they are open to this conversation, that they are, that they are looking forward to engaging with us on this. But the reality is that we need to find members of the majority who are interested and willing to make this their top priority when it comes to appropriations. And so that is the onus that is on us, is finding members who will go to their leadership and say, I will not vote for this appropriations bill if we don't fund this program. And that is what we are working on. The FY26 funding package has so many cuts in it to so many research programs. I hate to say that we are in good company here, but that is honestly the situation that we find ourselves in. Just being completely realistic, FY26 is not something that I have a ton of confidence in, though we are still continuing to ask that members do prioritize this for FY26.
Great.
Thank you, Brittany.
Yeah, thanks so much. Kind of moving on to the enhanced premium tax credits. Rich is asking a question about, assuming that they aren't extended in the budget that's currently being worked on, what is the prospects for future passage? I know, Jason, you were mentioning you're not very optimistic about any healthcare packages at the end through the end of the year, but what are the chances that they somehow get extended in another vehicle?
Well, I think for Brittany and I, like, the most likely compromise would be a shorter term extension. So a year, 2 years makes more sense than a single year. But we're still talking 2 years is almost $70 billion. So it's a not insignificant amount of money. In this environment, there would likely be demands for spending offsets in other programs, then not necessarily other healthcare programs, but in other programs. So I think even if it's not done right now, I think before the end of the year, there are Republicans that are very concerned about the potential for higher insurance premiums for their constituents, and for people not being able to afford their insurance. They are, I would argue, probably a minority of the majority, but given the narrow numbers, their voice is still pretty important. They obviously have I think a whole host of issues that they are concerned about in the CR, or potentially other policies they would like to see included. But I don't see an absolute roadblock to the expanded credits continuing in some way, shape, or form. So there's already been some talk about maybe further restricting the income limits, or applying stricter income limits would be one potential way of bringing down the cost of expanding or continuing the credits for another year or two.
Thanks so much, Jason. I think we have time for one last question. Not surprisingly, we have a lot of concern around access to affordable medication, and especially regarding the recent announcement of 100% tariff. So individuals are interested about the impact of that on prescription pricing, but also generic pricing, as they know a lot of generics are imported.
So I believe the tariffs are only on branded medicines right now, which is ironic since branded medicines are a tiny percentage of the prescriptions that are actually dispensed every year in the US. There was actually, as we started our call, there was news coverage. Pfizer, which is not one of our clients, was announcing that they were pursuing a couple different programs that would deliver lower costs for American consumers in return for avoiding any future tariffs. as it is right now, a lot of the branded medications, the ingredients there, or the medicines themselves that are imported, if they come from the EU, they're already exempted from the 100%. It would be a 15% tariff. And then the other thing to keep in mind is the companies are going to have to make individual decisions on whether they absorb the cost of the tariffs. To what extent do they pass that along? Do they pass that along in the list price, and therefore you have the whole, rebates and other negotiations? So I think we're a long way from knowing what the final impact on the cost of an individual medicine will be from these policies.
Yes, but we rest assured we will be monitoring this closely. Jason will be of help, Brittany, and the whole team at Crossroads. The National MS Society has obviously worked on access to affordable drugs for a long time, and we will continue to do so. So, I will wrap us up and transition to a minute, but I did want to say one more thank you to Brittany and to Jason for joining us today. Again, it's such a busy day. And we want to thank you also for all the amazing work you're doing for us on our behalf in Washington. Really appreciate your hard work. And now I believe I am transitioning to Laura Hoke.
Thanks, Stephanie. Thanks so much, Brittany and Jason. I'm excited to be able to tell you a little bit more about some of our state policy wins this year. So it is important to remember when I'm talking about these figures that even when things may seem tough at the federal level, we still have the opportunity to move policies forward across the country at the state level. And just note, this is not a comprehensive list, but it's some key highlights of state advocacy wins over the past year. And we are compiling our metrics internally still for this past quarter. So these numbers are through June 30th of 2025. So if you know something you worked on in your state and you don't hear it mentioned in the last few months, that is because we're still compiling things. So as of June 30th, the society and all of you worked on 72 bills in 35 states in 2025. Some big wins for us. We saw pharmacy benefit manager, or as a lot of you know them, PBM reform pass in Colorado, Connecticut, and Illinois. We saw a bunch of different types of insurance reforms in areas like step therapy, prior authorization, non-medical switching, and copay accumulator pass in states like Arizona, Colorado, Connecticut, and Maryland. Maryland also saw some drug pricing reforms pass. And continuing on, we have some great increased access to coverage through issues like reinsurance, biomarker testing, preventing discrimination and coverage passed in states like Minnesota, New Jersey, and Texas. We saw medical debt legislation pass in Virginia and Washington, and Texas passed an artificial intelligence bill to help protect consumers. And finally, Washington saw some improvements to their long-term care access pass this year. As a reminder, this is as of June 30th. This is not a comprehensive list, and every state operates differently. So some sessions in the states may have ended in May, while some others are ongoing right now. I know there were some hearings last week in Massachusetts. So for those sessions that ended in the spring, we'll be ramping back up in January. Of course, all of these successes would not be possible without the work of MS activists like you. You held meetings, you attended state action days, you submitted testimony, you wrote op-eds, you made phone calls, and so much more. So thank you so much, and we can't wait to see what you all accomplish at the state level in 2026. Now let's talk a little bit about federal level. I know you heard a lot from Jason and Brittany and Stephanie. But we do want to give you some good news on some things that we worked on this year. While it may seem like we have more good news when it comes to state level policy wins than federal, we do want to call out that there are major policy issues where we can celebrate progress, and we remain optimistic about our prospects for the remainder of the year. There are strong signs that Congress is hearing us, and bipartisan support on many of our issues remains strong. This is not a complete list, but it is there are some examples, which include telehealth access was extended in March through the continuing resolution spending bill through the end of the fiscal year, and we are hearing that it will definitely be extended in the next spending package, whether that's passed before the end of tonight or sometime in the next couple of weeks, because support is incredibly strong across party lines. We have helped build that strong bipartisan support through years of effort from MS activists like yourself. Maintaining funding for NIH is probably the win we are celebrating the most in 2025. A strong push for maintaining NIH funding has emerged. New leaders, such as Senator Katie Britt of Alabama, are surfacing. NIH funding levels in both the draft Senate and the draft House bills were strong, and we are absolutely thrilled to see this written out. The administration requested NIH funding be cut by 38% in the budget. However, Congress has not filled that request. There have also been no attempts to restructure NIH through the funding process for this fiscal year, which is another huge win because we do not want NIH to be reorganized via the appropriations process. And we do not want them to be reorganized without public, stakeholder, and patient input like yours. Finally, funding for NIH is one of the issues we brought to in-district visits in this August for all of you who attended those. So I want to take a moment to say thank you to all who participated in those meetings. We are so grateful that the work you did helped ensure Congress was receptive to our advocacy on that issue and protected that funding. So moving on, as many of you know, we often advocate for the VA MS Centers of Excellence funding as well. This year, it received an increase in draft legislation. While we may not see this come to fruition due to the likelihood of a continuing resolution rather than a final budget bill passed, it is encouraging to see that these increases are being proposed by Congress for these important centers that support our veterans' healthcare access. Any increase is a real rarity in this climate, so we're thrilled to see that written out as a proposal. Now a big issue that a lot of you are passionate about pharmacy benefit manager or PBM reform that still has a lot of strong bipartisan support in Congress. There are a lot of signs that there will be some form of a PBM package included in legislation later this year, so we're excited to work on that with you all. Finally, you may or may not be aware that the Society has joined other patient advocacy organizations in doing legal advocacy. We're following key cases and have joined amicus briefs on several issues of great importance to people living with MS. This year, the Supreme Court ruled the way we had urged them to in the Braidwood case, ruling that preventative services would remain covered free of charge under the Affordable Care Act. We joined an important patient advocacy group amicus brief on the case, which was submitted to the Supreme Court. And I would also like to note that this is the fourth time that the Supreme Court has upheld the ACA, meaning that we are now 4-0 at SCOTUS on ACA coverage. Finally, on this slide, you can see what we're going to be working on together for the remainder of the calendar year. We only have a few months left, but there's still lots of work to be done. So first of all, federal spending for MS research will remain a policy priority for us, of course. The appropriations advocacy cycle has really shifted to being a year-round process, so you're going to keep hearing from us on it and have multiple opportunities to engage on the issue. We'll continue to pursue strategies to restore funding to the MS Research Program, or MSRP, and we'll work together with coalition allies to maintain support for NIH funding. Second, we're going to continue working to support extensions of the Enhanced Affordable Care Act subsidies until we get that across the finish line. And finally, stay tuned for a launch, or really a relaunch, of a campaign to influence Congress to address PBM reform by the end of this year. We really want to get that done. Now, we've talked about policy wins and what's next. How can you all help us keep the momentum building through the end of this year and into 2026? First, you can help us build and grow the MS Activist Network. When you receive an action alert like the one in the QR code on the slide, be sure to share it on your social media channels and with family and friends. Do you have family and friends who want to get involved but don't know where to start? Have them sign up and join the MS Activist Network. By taking action on a single alert, they automatically sign up unless they select otherwise. You can also help by celebrating our wins with us. Everyone loves good news, myself included. And when we have wins at the state or federal level, we'll post updates on Society News, the homepage, as well as on our social media channels. Share those. It's great for people to see. Lastly, in addition to sharing your story with elected officials and those around you to raise awareness, share facts and figures. All of our action alerts and social media graphics include data points, facts, and figures that are impactful and worth sharing. And our ask of you today, while you're doing all that work, is hopefully an easy one. Invite 2 new people to join the MS Activist Network and start advocating with us. Next, you can help us garner media attention. This year, you've seen us launch storytelling campaigns. If you see a campaign on an issue that you personally are impacted by, please join the campaign and share your story. This allows us to work with the right MS activists for interview requests we receive, requests from Capitol Hill, and more to demonstrate the real life impact of pending policy proposals. And just a reminder, if you participate in these campaign gathering processes, we never share your story without connecting with you and making sure it's right for you before we share it externally. So if you share your story, we will check with you before we talk to any reporters, any offices on Capitol Hill, or anything like that. Just a few last things. As we wrap up, we did want to announce a new program that's coming soon to you all. We're very excited about it. We are launching the State Activist Leader, or SAL, program this fall. It is a volunteer role focused on state advocacy. SALs will be building and fostering relationships with legislators at the state level, as well as pursuing state level policy goals. One of the most exciting things about this program is that it is available in all 50 states. Though it is important to note that engagement opportunities will vary from state to state depending on what's happening in those states and what's available. Applications will be available for everyone who is interested on November 1st. So keep an eye out for that. We will absolutely send out additional information, a link to apply, and we are excited to see how many of you join us. Finally, thank you so much for joining us today. And a huge thank you to Brittany and Jason for taking time away from their busy schedules to speak with us. We want to encourage everyone to visit the Shaping Tomorrow Together webpage. And please, if you have not already done so, complete the survey telling us about your experiences with MS-DMTs and register to attend the virtual event we are hosting next month. Have a great rest of your day, and we really appreciate you all joining us this afternoon.